Assalamualaikum, everyone. Welcome to tonight's program. I'm Dr. Thara Nasir Gore, and tonight we'll be talking about the mental health impact of COVID-19. This is a really important topic for us to talk about, so I'm really excited that everyone was able to join us tonight because this pandemic has been going on for nearly 2 years now, and there's been a lot of ups and downs and a lot of transitions and changes, and now we're at this point where we're trying to adjust to the new normal, as we call it. And so, throughout this pandemic, people have been struggling with their mental health, but new challenges related to mental health are emerging over the course of this pandemic with all of the different hurdles that are coming our way. Um, Many of our lives, even though we're slowly returning back to normal, whatever we call that now, are not quite exactly how they were in March 2020 prior to then. And with the continued emergence of new variants and constantly changing guidelines, there's still a lot of uncertainty and unpredictability that we're dealing with. And there's a lot of feelings of anxiety and distress that are coming along with that too. So tonight we're going to be talking about just how exactly mental health has been impacted by COVID-19 over the years and what the data says now, how many of us are struggling across the country and how that's looking within the Muslim community as well. And we'll also take some time to talk about what we can do to support our own mental health, how to practice self-care, how to recognize signs of distress, and how to recognize when we need support as well. So there's a Q&A feature as well as part of this Zoom meeting. So definitely, if you have any questions, add them into the chat, and we'll spend some time in answering those questions at the end of the evening as well. So definitely feel free to add in questions as they come up. I would definitely want to take the time to address all of that. So let's start off by looking at exactly, what we know about mental health now and how it's looking in the midst of this pandemic. So 2 years later, we're seeing that about 4 in 10 adults are reporting to struggling with their mental health. Now, previously, prior to the pandemic, it was about 1 in 10 adults. So that number has quadrupled since we've been in this pandemic. So over the course of 2 years, we're seeing those numbers multiply significantly. And the way we're seeing people struggle is mostly in the areas of anxiety and depression, as well as trauma too. This pandemic is considered a collective trauma. We're all experiencing heightened levels of distress, a lot of fear, a lot of uncertainty, a lot of unpredictability. And so for that reason, a lot of people are reporting trauma and stressor related symptoms too. So you're seeing about 26% of people are reporting some form of trauma. About a third of people are also experiencing significant symptoms of anxiety and depression as well. And we're finding that about 11% of people are reporting suicidal ideation too. And so these are just numbers from the end of 2020. We don't quite have the data yet on what 2021 looks like and how it has evolved. So these numbers and these rates, they're continuing to increase. We're still learning more about how the pandemic has affected various different groups of people and how those numbers are evolving. But this is just only the starting point. I'm sure these numbers are going to get higher as well as we learn more and gather more information. What we're finding is that the mental health impact of the pandemic was the greatest in young adults. So particularly people between the ages of 18 and 24, as well as children and adolescents too. And we found that, there are greater challenges among racial and ethnic minorities too. And so, that includes Muslims as well. And what we found is that, overall, the Muslim community was slightly more impacted than the general public when we're looking at the negative mental health impacts of the pandemic. Muslims were slightly more than the general public to feel nervous or anxious or on edge nearly every day. They reported greater feelings of depression or hopelessness more than half the days or more, and to feel angry as well a significant amount of time. And so you're finding that, not only was the country as a whole, the world itself was struggling with mental health, but you're seeing a greater impact within the Muslim community as well. We're certainly struggling as a population, and you find that within the Muslim population as well, people are less likely to seek support if they are struggling. And so you see those numbers increase as well as a result of that too. Um, and in addition, you find that Muslims compared to other individuals and groups in the US struggled with difficulty sleeping. They experienced increased increased conflicts within their households. And we found that Muslims specifically below the age of 50, that 18 to 49 range, so young adults as well as middle adulthood, they were the ones who experienced the greatest mental health impact in connection to the pandemic, which is really similar to the rates that we're seeing in the general public as well. But it speaks to just how important it is to bring awareness around mental health and speak about how we can take care of ourselves and mitigate any of the challenges that are coming up as a result of this pandemic too. And so, a big question that we have to ask as a result of that is, why has the pandemic had such an impact on our mental health? Working from home and, may sound nice at the surface level, but there's a lot of other challenges that came along with the pandemic. The biggest one being a loss of routine. Now, as little as that may seem, routine is actually something that is very important to our mental health. It's something that gives us a sense of control around our environment. It gives us a feeling, it gives us consistency. It makes our environment feel predictable. And when something is predictable, it feels comfortable, it feels safe. And so when that routine is taken away from us, we don't really know what to expect, whether it's the next day, the next week, or even the next month. And especially during this pandemic, it really can be difficult to look forward into the future and know what to expect. It's hard to say what March will look like, or even how things will look 6 months from now. Like, things are constantly evolving, whether it's because of new health restrictions, because of new variants, or even because of that return to normalcy, as we're trying to call it. And we're finding that during the pandemic, and even now, many people are struggling to establish or keep a routine. For some, people are still working from home, or students are still attending school virtually. Some college students are, while others are beginning their transition back. Maybe some people are working more of a hybrid model. Some students might be attending school virtually and in person, while there's another group of people who are fully back in person. And we're finding that from person to person, that return to normal and what things look like now looks very different. And there's a lot of variance. We may be expecting to go back to work fully in person in the near future, but I'm finding with a lot of people that I know, even those start dates are even getting delayed, whereas they're thinking that they're starting in person next month, and then it gets delayed to the next month. And so it's hard to really think too far in advance, and that can cause a lot of distress as well. And because of that, because our work lives, our academic lives, even our personal lives are so shifted, where our general routine, our wake up and our sleep times, our meal times, our general habits are kind of left and lost in the wind. And so it's hard to really know exactly what to do then, and that can make us feel really distressed at times. And that loss of routine, that comes in hand in hand with the feeling of unpredictability as well. We've been experiencing a lot of unpredictability. We're still asking ourselves, how long will this last? Will there be another variant? Will that come with more restrictions? How can I stay safe? Will I be working or going to school from home? Is my child's class going to be quarantining from an exposure? There's just so much uncertainty, and that can leave us feeling on edge, which can further add to feelings of distress or anxiety. And, more importantly, we've experienced a lot of social isolation over the last 2 years. A lot of individuals haven't been able to see friends and family with the frequency that we once used to, and that can lead to feelings of loneliness and depression. And this can be especially hard for those who have loved ones that are overseas, in countries where we might not feel comfortable traveling to just yet, whether it's because of, the COVID restrictions or the state, or how things are in COVID terms in that country as well. Um, it's even major holidays having quite felt the same. Ramadan is coming up soon, but the last 2 years, Ramadan has been drastically different than how we normally celebrate it. This is a holiday where we come together as a community, we see friends, we see family, we, break fast together. And it hasn't quite been the same yet. And so with this upcoming holiday, we're hoping that, there's going to be more social contact and we'll see more people. But even then, it can be isolating because not everyone is moving at the same pace as others. We're all returning to normalcy at a different rate, and everyone has a different comfort level. But it can be really challenging too. And for others, it's just the opposite. Social isolation isn't a challenge, but instead they have to spend more time at home and spend time with individuals who might not be the healthiest for them. They might be invalidating or critical or difficult to get along with. And so being at home could even further add to the distress that they might be experiencing. So the way our social dynamics have really shifted over the years can really impact our mental health as well. Where not only where some of us are on our own, we're feeling isolated, we're feeling lonely, whereas others, we're in environments where we don't really feel good. We're interacting with people who might not help us feel good and might have the opposite effect on us. And so we're in these environments where there's just so much going on that it's hard not to feel overwhelmed. And then along with that, especially at the beginning of the pandemic, a lot of people were experiencing job loss too. There were, not only shifts in how, the work life looked like for us, but individuals were losing their jobs. And that could also lead to increased depression and anxiety and distress and low self-esteem. And that in turn can lead to challenges with substance use or even concerns related to suicide too. And then I think the last one is the biggest thing that many people are still continuing to struggle with as well, is learning how to separate work from home. I think for those of you, especially who are working from home, working from home may have its benefits, but people are actually experiencing burnout more than ever. Living and working in the same physical space allows for less separation, and which means that you might not be imposing the same boundaries you would have had in the past. Meaning if, your boss emails you and says, hey, let's jump on a quick Zoom meeting right now because we need to figure out this big issue before tomorrow's big meeting, and it's 7:00 at night, it's very easy to say, okay, yeah, sure, it's no problem. My computer's right there. I just need to move from the couch to the chair and hop on this Zoom meeting and I can get it taken care of. Whereas if we were in the office and we were physically working, we would very much say no. We are at our office during our hours. And then outside of that, we wouldn't be as flexible with last minute calls and last minute meetings. We're more accessible to, the workplace because of work from home. And for that reason, it can be really hard to set boundaries. So you're finding that a lot of people are working more than they were in the past. Some people are feeling burnt out and overwhelmed with all that they have to do. People are finding it really hard to say no or to set boundaries. And there's some people who are even feeling reluctant to take sick days because you're already home. So what exactly does a sick day look like for you then? And so setting these types of boundaries have become increasingly more difficult in the wake of this pandemic. And all of this together, and this is not an all-inclusive list. There's so many other factors that, can contribute to our mental health and how this pandemic has been impacting us. But all of these stressors together have been contributing to a lot of the anxiety and depression and distress that we're seeing among people these days. And so, that in addition to something else that is starting to emerge as well, something called COVID burnout or pandemic fatigue. I want you to think to yourself for a moment, how many of you have thought to yourself, I am so tired of this pandemic. When is this going to end? I am so tired of being on Zoom meetings all day, of being behind my computer, of not seeing my friends as much as I used to, of not seeing my families as much. I'm tired of, being restricted to the tri-state area, or like, not having the chance to travel or do all the things that I had planned. And, that's pandemic fatigue, that's burnout. A lot of us have reached a point where we've kind of had enough of it. It's been 2 years. It's been a very long time. You're tired, you're frustrated, you're feeling depleted, exhausted. You've really used up a lot of your resources, and that's okay. That's a normal experience and feeling to have. At the beginning of this pandemic, our short-term survival skills kicked in. Fear and anxiety, that's what kept us motivated. And that's what kept us on edge and alert and engaged with our world. But over time, that fear, it's subsiding and the frustration is growing. We're exhausted, we're just kind of giving in, and our bodies are not designed to handle this much stress for this long. So it makes sense to not feel okay. It's okay to feel burnt out and tired and annoyed and frustrated with the situation that we're in. We're still trying to adjust to this new normal. Um, and, you know, it's an emotionally exhausting experience. Like I said, the constant ups and downs, the loss of routine, the unpredictability. It's a lot to just mentally and even physically manage. Um, and what you find is that, because burnout can look very different across people, especially when we think about pandemic fatigue and COVID burnout. Some people might be feeling cynical and emotionally exhausted, and those are usually two of the most common burnout symptoms. We feel drained and just, we might be looking things through more of a pessimistic lens when we're looking at the world around us. This pandemic, it won't end, and it's at this rate it's never going to end, and the things that I wanted to do, I don't know when I'll get to do them. And that's the cynicism that's setting in. We might find that, because of burnout from the pandemic, we're going to start feeling burnt out at work too, and part of that is the boundaries that I had mentioned, but generally we just feel like we might be less effective at work too. Burnout happens when we run out of our personal resources. A lot of self-doubt might be creeping in over time. We might not be paying as much attention to our work. We might not be as engaged in our tasks too, because it's a lot. For those of you who are, zooming into work every day, doing everything remotely, staring at a computer for 8+ hours is mentally and physically exhausting too. And for those of you who are, transitioning back to working in person, that's another different type of adjustment. You're resetting your sleep and your wake schedule. You're getting into the habit of commuting again. And then there are those of you who had been working in person, going into the office, going to the hospitals, going wherever you go, all throughout this pandemic. And that in itself has been caused a different form of burnout, because you've been working full force at your full resources nonstop throughout this very emotionally exhausting and draining experience. You might find that, we might be experiencing a strong sense of anxiety about the future too, and that might be the burnout as well. Your anxiety might be related to the future, your own future, the future of your community, or even the future of the wider world. It's hard to really speak about anyone's future right now. And what you're finding is that in line with burnout is that some people are, feeling frustrated with a lot of the health guidelines that, are constantly coming out, or that are in place. Some people might be less willing to comply with guidelines because, there might be a feeling of hopelessness in play, where we feel exhausted and we're tired and we're like, okay, well, what's the point of wearing masks all the time? The COVID's not going anywhere. It's not going away. And so you're finding that some people are becoming tired of restrictions and because of mask wearing and social distancing, and they're growing tired of it. But, that might not necessarily be helpful from, a global health perspective. But when we're looking at it from a mental health perspective, that's telling us that might be a certain sign of burnout as well. That might be, our mind's telling us that we're feeling really stressed out and overwhelmed. And there's just so much at play with this pandemic. And I'm sure I've mentioned a lot of different experiences and reasons as to why we might be feeling the way that we feel. And I'm sure that I haven't captured everyone's experiences because it's just so unique. And this pandemic has hit us in so many different ways that it's hard to capture all of that. But as we think about the burnout, the distress, the fatigue that we've all experienced, the big question that we need to ask, and the most important thing is, how can we cope? And that's the big thing. Like, there's a lot of steps that we can take to take care of ourselves. Some of them are really small, like little changes that we can make, whereas others might be a little bit more challenging steps and might require more of a journey, but could be helpful for us in the long run in addressing some of the feelings that we're experiencing. And so as we think about adjusting to this new normal that we have and what the state of the world looks like now 2 years later, we need to take some time and pause and take some inventory of what we need. We need to bring some awareness of our own emotions. And so that means like taking a moment, thinking about what it is that you're feeling. Like, sit with yourself and see what it is. Is it anxiety? Is it sadness? Is it hopelessness, exhaustion, boredom, loneliness, or even a lack of fulfillment? Consider like what you've been experiencing physically too. Are you experiencing a lot of like physical tension, increased headaches, difficulty with breathing, feeling like you're constantly on edge? Do you feel like you feel overly restless at times too? Or, think about what thoughts are passing through your mind. How do you feel like, do you find that you're becoming more of a glass half full type of person? Do you feel like that you're focusing and ruminating more on the negative? And then also stopping to think about what actions are we taking that are adding to these emotions? When we think about mental health, there's so many different aspects to it. It's not only just the feelings that we have, but it's the thoughts that are running through our head. It's the way we are acting and reacting to our environments. And so we need to, take a step back and see exactly what that is. What are the thoughts that we're experiencing? What are the specific feelings that we're having? And what are the actions that we're having that may be adding to those emotions? And as we do that, we need to acknowledge the emotions that we are experiencing and take the time to reflect on it and process, what's missing? What do we need right now to address those feelings? Whether it means, maybe I'm feeling lonely and I feel like I've been having a lot of social isolation and that's making me feel sad. And maybe I'm starting to think, maybe I'm missing out on a lot of experiences. I'm having a lot of FOMO because I'm seeing people on social media out and about, still meeting with each other, but I'm still at home and trying to, take care of myself. And so maybe that's where I need to take a step back and think about, well, how can I help myself feel more social, feel like that connection that I feel like I've been missing? And, how can I do that in a way in which I feel comfortable and I'm staying within my means, but also, helping myself emotionally as well. And so, this is easier said than done. Sometimes it takes like a deep dive into our emotions to really understand what exactly is missing and what do we need. And so sometimes writing it down in a journal or even talking it out loud to yourself or even a trusted confidant can be really helpful too. It's a good way of making sense of how we're feeling, just kind of talking it out and, seeing like where our mind and our thoughts really take us. And as we do that, we'll see that like what we need to do in terms of our smaller goals. So if we're thinking about, like I said, feeling socially isolated and feeling lonely, maybe we might find that the step that we need to take is, setting up a weekly FaceTime call with someone that, we enjoy spending time with and that makes us feel good. And having that as a scheduled date, like every week on Thursday at 5 o'clock, I'm going to be FaceTiming with this person and that's our designated time. And so then you have something to look forward to in your week. And then you also feel like you're getting that connection and you're getting that fulfillment in that way. And so like those small manageable steps that you can take to address those concerns can really go a long way. And not only taking inventory of what you need, but also focusing on what we can control. There is a lot going on right now that is out of our control. We can't control this situation. We can't control when this pandemic is going to end. We can't control the restrictions in our state. But what we can control is, where we go, how we protect ourselves, and even like what steps we can take to, take care of our mental health. So, for example, if reading the news is really stressful, taking a break from reading it every day um, can be an action that we can take to have more control over our environment and having over our feelings. You know, having patience with ourselves, staying flexible, like all of that can be helpful too. Like with this pandemic, there's a lot that's out of our hands, but we need to focus on what is in our hands. And we're in charge of our own actions. We're in charge of how we react to certain situations. And so with that, like we need to think about like what we can do in the wake of all of this to help ourselves feel comfortable and to help us feel like we're working within our means and within our comfort levels. Setting boundaries is also really helpful during a time like this too. It's okay to set boundaries with friends and family and colleagues if you're feeling overwhelmed or anxious. We've all experienced a range of emotions over the last year, and this transition has been different for everyone. And so focus on, nurturing the relationships that are really important to you. But if you find that there are some relationships that are taking away too much and things are starting to feel overwhelming or draining, then maybe that's where we kind of need to like set some separation, whether that means just saying no and not being a yes person, to a lot of things, whether it's work related and saying like I'm going to clock out at 5 p.m. at the end of the workday and I'm not going to check my emails during certain times, and I'm going to try to work within my work hours. Or whether that means you feel like you're giving and giving to your family and your friends and you feel like you're pouring from a glass that's empty, then maybe telling people that you need to take a step back and you can't really contribute as you might have before. So setting those boundaries can be difficult, but it's actually quite healthy for our mental health to set that up. Learning to say no is really hard. Many of us often feel obligated to say yes when someone asks for our time or our energy. But, like I said, if you're feeling really stressed or overworked or anxious, like it's okay to take a step back and say no, because if we keep saying yes and we keep giving and giving and giving, that's going to lead to burnout. And burnout is not good for our mental health. You might find also is that you might be living with people who are also a source of distress. And so setting boundaries, physical boundaries, can be helpful too. So knowing when to step away and having some clearly established alone time as well can be helpful too. And just communicating that need for some separation and having just that me time. Mindfulness is, I think, a word that is used a lot these days. And so it's actually a really helpful tool and approach when we're thinking about taking care of our mental health too. And so what mindfulness is that it means we're learning how to focus on the present. We're not focusing on what happened in the past, what happened in the future. It's what's happening right now in this moment, in the here and now. And we're fully focusing on that. And there's a lot of different ways we can practice mindfulness to relax and to recenter. Because what we find is that anxiety and depression can stem from thinking too far up into the future, thinking about what's going to happen next. Will things work out as I expected? Or ruminating too much on the past. These bad things happened and it's terrible. And look at how things are working out. And there's so many things that went wrong. And so when we're focusing too much on the future and the past, then we lose sight of the here and now, the present. And so mindfulness really stresses us to focus on that. And there's a lot of different ways we can be mindful. Relaxation exercises like yoga, practicing deep breathing, meditation, even prayer, those are all really helpful, mindful approaches. Looking to religion during times of distress can be really helpful because it can provide us with a sense of comfort and hope when it feels like things are out of our control. And what research has actually found is that, Muslims who use religion as a coping mechanism during the pandemic, they were more likely to cope with feelings of anxiety and depression. And so, you do what works for you. So, for you, that could be prayer, or it could be practicing yoga, taking, a mindful walk through the park, doing something that is calming and soothing. And as we're doing that, we're trying our best to focus on that activity and focus our thoughts on that activity only, and not letting outside voices or even our own external thoughts entering into that moment, because that's where that anxiety and that distress can stem from. And so just keeping it out for that moment and keeping it at bay is really what mindfulness is. And it's something that takes practice. It's not something that we could do right away all the time, but it can be a really helpful approach. And then, I think this is the biggest thing, like working on strengthening the relationships that you have. As human beings, we're social animals. And so for that reason, like that's why this pandemic has been so hard for us. A lot of us have been socially isolated, as I've mentioned. And, as inherently social creatures, having a lack of social contact can cause a lot of distress. And, during this pandemic, it might be hard to find new relationships that might take up a lot of time and energy. And depending on what your specific circumstances are, maybe that's possible for you. And for the others, it might not be. It might feel too tiring or too overwhelming. And for those of you, then in that case, it might be helpful to lean into some of the relationships that you have already established. You know, take some time to connect with people that maybe you've lost touch with over the course of the pandemic, or keep in regular contact with the people that we feel close with or that feel good to you, because then we can get that social connection that we've been wanting. And that doesn't necessarily mean going out for dinner with friends every night, but it could be as simple as making phone calls, arranging video meetings, chatting on social media, writing letters, even taking live online classes and participating through programs that way can help us feel like we're a sense of community too. And for everyone, that community, that like a sense of friendship or like social connection, it's going to look different. But trying to take steps to strengthen or build those relationships is really helpful as we're coping with this pandemic and adjusting to what life looks like today. And just going back to routine, what I said before about routine being a really important part of our mental health. So many aspects of our lives may have changed in the last 2 years, and I'm sure there's many more changes for us to see in the near future as we move forward. And so sticking to our daily routine in whatever way we can helps us maintain a good mental health. Now we can't have the same exact routine that we had prior to March 2020, but narrowing our focus on those routines that are necessary for maintaining our livelihood is a good first step. And what I mean by that is having consistent bedtime and wake up times, having consistent meal times, eat breakfast and lunch and dinner at the times that you typically would have, and try to be consistent with that. I think during the pandemic, sometimes people even lost track of time at times, that we would even forget to eat, or we would maybe overeat. Like it's different for everyone. Or create a routine where you're maybe waking up a little bit earlier than you usually would, making time for physical exercise and try to do that on the regular. Create a routine for how you want to go about your work day or your school day, or work on your assignments. Having that designated carved out time in those windows, like that gives us structure, it gives us stability, and in turn that makes us feel more secure. But beyond the taking care of our physical well-being and making sure we have a structured routine for work or for school, also make time to schedule in time that's important for your own like emotional health. Schedule in time for activities that are fun, creative, that allow us to have social connections with others, times for stress relief, and like having that time carved out, because sometimes we can say that we're going to focus on our self-care, we're going to do something fun today, and we can set that intention, but sometimes if we don't schedule it and really carve out time for it, it's very easy to overlook that as well. And so having that in our daily routine can be helpful. And just like routine as a whole can help in regulating our mood and just give us a good foundation for dealing with the different stressors that might be coming our way. And beyond those different actions that we can take, thinking about our mindset during the course of this pandemic and trying to shift it can be really helpful too. Thinking about things in a different light, um, and will help us reduce our feelings of distress, because right now if we ruminate on the negative, that's going to only further add to any feelings of anxiety or depression or stress. And so what I mean by that is, if you're thinking, I'm stuck at home, we need to reshift that thought. We need to think about it more so as, I get to be safe in my home and spend time with my family. We need to think of it less so, glass half full, and as, glass empty and glass half empty to glass half full instead. So if you're thinking, I will get sick if I go to work or when I return to school or work fully in person, then we need to remind ourselves, we don't know that for sure 100%. We need to think of it as, I'm doing what I can to take the appropriate health precautions and decrease those chances of getting sick. So everything that's within my control, I've done. So I've done what I can to reduce my risk. And, that's what you need to focus on. Or if we're focusing too much on the uncertainty that we're feeling and that feeling of overwhelmingness and unpredictability, then we need to tell ourselves, okay, you're right, I can't control the situation, but there are things that I can control. I can control my actions. I can, practice taking deep breaths. I can call loved ones for support. I can take care of myself physically and get proper sleep and nutrition and do things during the day that will help me during this time. Or, I'm sure many of us have thought this at some point, thinking this will never end. This pandemic is going to be going on forever. But, we need to rephrase that and shift that mindset and think about it as, this too shall pass. And you know what? This pandemic will give us a newfound appreciation for the things that we took for granted 2 years ago. It's really bringing to light all of the important things that, the small luxuries and privileges that we had and never really realized or recognized. And if anything, this is an experience for us to have more gratitude and gain more appreciation for what we have and will have when this does pass. And I'm sure many of us have also experienced a lot of frustration about how this pandemic has ruined our plans even. And so even there, we need to think about it as, it is what it is. It's beyond my control. There are some things that, as frustrating as they are, they're out of our hands. And so, we will reschedule those plans. We will do those things when we're able to, because that's all we can do. We can set that intention and wait for this moment to pass and then follow through with those plans at a time when it feels more appropriate for us. And so, it's important to, remind ourselves throughout this, this time, you're doing the best that you can. Although we can't change the situation, we can adjust our thinking. And so, as, you think about the thoughts and the feelings and the experiences you've been having over the last 2 years and presently, take a moment to even, catch those thoughts that you're having. Are they more gravitating towards the negative? Are they, running to the extreme, as in, are you seeing a lot of nevers, won't, this will never end, I won't be able to recover from this? And try to shift that thinking to a less, extreme end and see, what are the possibilities? What are some, slivers of hope that we can think to and look forward to? And also just reflecting on this pandemic, we don't think all the way back to before the pandemic. Think about the past 2 years and how far we've come. Look at all the things that you've been through, how resilient you've become, our communities have become. We are very adaptable creatures is what we've learned in the last 2 years. And so giving ourselves credit where it's due is really important. And so we need to recognize and acknowledge those small victories that we may have had. So it may not feel like we have done a lot or have accomplished a lot, but surviving, managing, getting through, making things work, making ends meet, that's a lot during a time like this. And so we need to give ourselves credit and recognize that. We may not have been able to meet the goals that we had set for ourselves at the start of the new decade in January 2020, but we've done so many other things that require recognition. So when we're thinking about all of that, we also need to think about what steps we need to take to practice self-care. And it's really important that we take the time to recharge daily and take care of ourselves and participate in regular self-care routines and work them into our schedule. Um, and so, work-life balance, school-life balance, all that is really hard to manage as it is. And during a pandemic, it's even harder. And so what we need to do is, take some time, take some breaks throughout the day or throughout the week where we focus on ourselves and take some time to take care of our mind and our bodies. And so, like I said, some of this stuff is just, returning to some sort of routine with our sleep schedule, our eating habits, and even our exercise. Even though that's important for our physical health and our mental health are very much connected. And so if we're taking care of our bodies and taking care of ourselves physically, that in turn is going to help us feel better mentally as well. Practicing gratitude is also important. Like I said, give yourself credit where it's due. It has been a very long 2 years. And so we've all been through different hardships to varying capacities. And so we need to recognize not only what we've done and what we've accomplished, but also the things that we're grateful for. I think there's a lot of things that we may have taken for granted 2 years ago, and now we're recognizing like just how special and important it is to us, whether it's our relationships with others, whether it's our own ambitions, our own goals, where our lives are currently, our own privileges. Those are all things that we should recognize, because as we practice gratitude, that will also add to our feelings of self-worth and add to us feeling hopeful and feeling good about ourselves too. Sometimes even during this pandemic, especially, taking a break from social media and the news can be a really good form of self-care as well. Watching the news constantly, especially during the pandemic, I'm sure many of you were like me. I was watching, those daily press conferences every day, reading the news constantly, looking at the numbers and the rates, and that was causing a lot of distress. And so one thing that I've learned over the course of this pandemic is just mediating how much media we take in. Making a regular habit to step away from our computer or our phones and not scrolling through our feeds for the latest news updates. And because the news cycle is 24/7, things are constantly being put out there, things are constantly changing. And so maybe it's helpful to take the time to just check the news once per day around the same time daily. And when I say a media break, I don't even mean just the news, but even taking a break from social media can be helpful too. I think especially during this time when we're looking at social media and seeing people out and about and doing so many different things that maybe we don't feel comfortable doing just yet, or things that we haven't had the opportunity to do just yet because of this pandemic, it can feel very frustrating. It can give us that fear of missing out, that FOMO. And so taking a step back from social media can help us bring things back into perspective, because what you see on social media is that people are posting all of the positives. You're not really seeing what's going on beyond that surface. And so people might be struggling, they might be having a hard time like you, but that's not what's being posted. And so sometimes we need to take a step back and take a break and also acknowledge that as well too. Spending time outside too, some fresh air. This weather is, in New York at least, is starting to get beautiful, and we're able to spend more time outside. And so taking that time, maybe even just breaking up that routine where we're at home all day, going out for a walk, can be helpful too as well for our mental health. Studies show that like getting outside can help reduce fatigue. It can help us overcome symptoms of depression or even help with burnout too. So, and getting outside can help with our sleep as well, because especially if we're doing some form of physical activity, that can really help us in feeling good. Getting organized too is a really big and helpful thing. I think in the midst of all this chaos and clutter and information being thrown at us, organizing what we can is a really good first step that we can take to figure out what it is that we need to do to take care of ourselves. help our lives feel organized and more in control, because sometimes organization can give us that sense of control, because part of a routine is also being organized. So small changes like keeping a planner or a calendar, writing down all of your responsibilities and appointments, maybe even doing some spring cleaning in your home, that can help us, in a sense, reduce any mental clutter that we might be experiencing and help us get some more clarity as well. Um, and maintaining our hobbies. I think, for some people embraced the pandemic and they really delved into and leaned into a lot of hobbies and explored ones that they may not have considered before, whereas others felt really distressed and overwhelmed and burnt out that they didn't have the headspace to focus on their hobbies or their interests, whether that was reading books or drawing or exercising or um, you know doing many other things. And so carving out some time for self-care, and that means your hobbies as well, can be helpful for our overall mental well-being. And so, it sounds hard to schedule time for yourself, but even if it's just 15 minutes a day, that can make a huge difference in your mental health. It's hard to carve out an hour of self-care every day for some of us. Everyone's lives are in very different places. Some jobs are more demanding than others, and it can be hard to find that time. But even like 10 to 15 minutes where you're just reading a book or coloring or watching the latest Netflix show that you're very much into, like all of that can be a part of that self-care and taking care of ourselves. And practicing self-talk. And that goes hand in hand with what I said previously about shifting our mindset, thinking about the positives and just, catching ourselves when we're ruminating on the negatives and just trying to challenge those thoughts, thinking about the positives of the situation, trying to recognize what it is that we can control. All of that can help us in, addressing any feelings of distress that we have too. And then also setting some realistic goals for ourselves. I think there's a lot that maybe we want to accomplish during this time, or things that we continue in wanting to do, but it can be really hard when we set a really big goal. And so we need to kind of take a step back and think about what's realistic, think about what's manageable. Maybe I wake up tomorrow morning and I say I want to run a marathon, but that's a really big goal for someone who's not an avid runner. And so I need to set those realistic and manageable goals. I need to think about the smaller steps that I can take that will ultimately lead to that larger goal, whether that means, running around the block or just going for like speed walking for now, and then gradually build up to that marathon. That's what's going to help us feel more accomplished. And if we set goals that we can meet and that are realistic for us, that's going to add to our own self-worth. That's going to make us feel better about ourselves too, because we feel like we're checking something off of our to-do list, and that feels good versus having something big and daunting and overwhelming that's just kind of looming over us. That's only going to add to our anxiety and distress. So you really need to break it down in a way in which things feel doable. And then, it's also important to have regular check-ins with yourself too. Monitor yourself for, signs of sadness or depression, stress. Notice if you're having any difficulties with sleeping, any like intrusive thoughts, feelings of hopelessness. Because if you're noticing that you're feeling distress, then that means that maybe it's time for you to talk to, someone that you really trust, whether it's a friend or a family member. Or if you feel like things are, even beyond that, then maybe it's, an opportunity to seek some professional support as well if you find that your symptoms are worsening as well. And so with that in mind, I want to take the time to just talk about recognizing these signs of distress, because there are little things that we might be experiencing or dealing with that are pointing to us struggling, and we might not actually always catch it. And so I definitely want to bring awareness to that tonight. And so some things to keep in mind are, when our mental health is declining, it can be hard to enjoy life in the same way that we used to. Maybe we're feeling tired. Our energy is not quite as it used to be. We're not as motivated as we want to do. Things just feel like too much work and they require too much effort. And it's hard to take that step that we need to maybe follow through with the task. You might find that, if you're feeling distressed, maybe there are changes in your eating or sleeping habits, and that can vary from person to person. Maybe you find that you have a lack of appetite, or maybe you have too much appetite, or even with your sleep, maybe you're finding yourself tossing and turning throughout the night. It's really hard to fall asleep, or you're waking up in the middle of the night and you're becoming very restless as a sleeper. Or just the opposite, maybe all you can do is sleep and you find yourself being in bed all day and it's really hard to drag yourself out of bed in the morning, and it feels like a struggle. Um, Changes in our mood as well is something to keep in mind. Feeling sad, irritable, worried, scared, or on edge. If you find that like every little thing is annoying you, if you feel like everything's frustrating you and just like everything is just bugging you, then that's something to be aware of as well. Sometimes our anxiety, our distress, our sadness can come out as irritability as well, or as anger or as frustration. So that's something to not only be aware of in ourselves, but also those around us too. Um, and then finding, and also difficulty in coping with stress, things that maybe on the regular we weren't able to manage or handle, those daily problems or activities that we like could get through and manage. It just feels like too much. It almost feels like this weight that's crushing us, and it's hard to cope with that and managing those regular responsibilities that we could do. um, you might find that, other signs of distress or difficulty with concentrating. If you find that um, you can't focus as well as you used to, you find that you're more distracted, um, your attention's not quite there, you feel like you're not as present as you once were, that could also be a sign of distress, as well as increased, anxiety, fears, and worries. And then also a big one is withdrawal. If you find yourself spending more time alone, social distancing aside, but you find that you're actively withdrawing, avoiding social activities, avoiding going out with others, not wanting to even talk on the phone, you just kind of want to be on your own. And that's also something to recognize within yourself as well. And these are all signs to not only look out in yourselves, but also, within others too, that we are close to and that we see, because everyone is struggling to some degree in some sort of way. And so you want to be aware of these signs of distress, because, these might be signs that, somebody needs support, whether it's ourselves or someone else in our lives. And so when we're thinking about seeking support, for the first level is always like we find that we go to the people that are, important in our lives, whether it's friends or family. They can be a great source of support for us to lean on during difficult times. Ignoring the feelings that we're having, the emotions that we're experiencing, doesn't make them go away. And so eventually they'll come exploding out. And so it's helpful to have a space where we can talk about that. Um, you might find that, the challenges that you're having, maybe they exceed what, our friends and our family can do for us. And maybe that we need to, consider some professional support instead, having someone who can help us in navigating these challenges, helping us build some skills and strategies that are more specific to our particular situation in, a productive way, can be helpful too. Um, like talking to a mental health professional could be the outlet that we need to begin feeling better and find the strength that we need to ride out this pandemic. And so I've listed out some resources as well if you're interested in seeking support for yourself. Psychology Today is a really great directory of, mental health clinicians who are available within your area. You can search by zip code. You can even filter it out by if they take your specific insurance company, by languages, by gender. Like you can really specify what type of clinician you're looking for, and those filters will help you. The Khalil Center here in New York is also a really great resource. They offer mental health supports for the Muslim community too. They practice a lot of psycho-spiritual psychology as well. And so that might be a really helpful resource for those of you who are looking for that type of lens or that type of perspective. And then there's something called SouthAsianTherapist.org, which is helpful, where it's a directory of therapists who identify as South Asian, who, speak a variety of languages as well. Sometimes it's helpful to, participate in therapy in a different language. We can better express ourselves in other languages than just English, for those of you who are, multilingual. And so there's a lot of other resources out there, but I think these are some really good starting points. For those of you who are joining that are NYU students, NYU also has a lot of resources available, myself included. I'm there on campus and I'm there to, meet with students for therapy and counseling as well if they ever need that. So, that's all I have for tonight. I really appreciate you all taking the time to, be with us this evening and, participating in this meeting. I have my email address listed here if any of you have any questions that come up, but I also do want to take the time to address any questions that you may have right now. So I'll spend some time doing that right now too. But if anything comes up after the fact, feel free to reach out. So I'm going to stop my screen share. Okay, so one question that we received is, how often should we do a mental health check-in? And what are some questions we should ask ourselves during it? And I think that's a really good question to ask. A mental health check-in could be something that we just maybe spend 5 minutes at the end of each day doing with ourselves, where we just kind of reflect on the day, like, how did this day go? What were the highs of the day? What were the lows? What didn't feel so good to me, and where is that coming from? Am I feeling stressed about something today? Am I feeling overwhelmed? And what are those things? And maybe that's where we can kind of think about what we need to do to address those stressors if they are within our means and within our control. And so checking in with ourselves, even for a few minutes, like I said, every day at the end of the day, can be a really good way to do a mental health check-in.